because we are sick and tired of being abused and we want South Africans to be prioritized in South Africa. I don't understand why is it that when you're doing something for your country, all of a sudden it needs to be attached to some gain? You know what I mean? It doesn't need to be attached to some gain. Some of us are just ordinary Dudula members. We just pay membership and we are just ordinary members. None of us are in positions. None of us have been promised anything. We are just on the ground. We are fighting. That's it. There's nobody who has funded Operation Dudula. If they had Pakunzi, the organization would be flying. The marketing, the PR of the organization would be immaculate, because it would mean that we are able to pay firms legally as well. We'll be able to send lawyers in court to go and fight high-profile lawyers, etc. So there's no funding that is coming to Operation Dudula. There's nobody using Operation Dudula. We're just fighting for South Africans. And if you are going to say that fighting for South Africans means that we are being paid or we are being bought by someone, then so be it. Deal with it. It's your baby to up.
Okay, can I ask you?
Thanks.
Okay, can I ask?
Yeah, sure.
Azania,
Undercover, you want to ask a question?
Okay, Azania. Okay, how many members do you have in Operation Dudula? How many members, and how much a member for your membership?
Send an email to Operation Dudula and inquire, and you'll get the answer. As to how much, you can also inquire about that. So yeah, the information is available there.
But if it is for people,
do you know why I ask now? Do you know why I ask? I was listening to what you say, because you said you are funding as members of the Operation Dudula. So I thought maybe, guys, I'm gonna say this: when we're engaging here, there's no need of attacking. We just engage normal conversation. I just ask question according to the submission that you asked, because you said you dismiss everything. You said Operation Dudula it's not being funds. It's not being funds with YTs and people. They are saying all this nonsense. So I thought maybe you've got correct information. It's a simple question: how much the membership and how many the members?
Literally just told you. But I've just told you that I'm literally a member of Operation Dudula.
Okay, thank you.
No, but hold on. I've just told you that I'm literally a member of Operation Dudula. I'm not the admin of the website or anything like that. I'm telling you, if you want to find out.
I understand. I get
hold on. If you want to find out that information, you can simply just go and ask for it. It's as simple as that.
You know what?
If I wanted to join the EFF, I wouldn't be asking you for the details of it. I would just go online and find out how much is it to join the EFF. It's as simple as that. What's odd about
Okay, Azania. Okay. I just ask you because I thought maybe you know it. You understand according to the question.
Even if I did know it and I don't want to answer, you can find it out yourself online. What's odd about my answer?
Okay, I've got a question for.
Yes, I don't even care for you to answer. So because you're the one who just saying nonsense things here, because you can't support it.
No, but I'm telling you that there's nothing wrong about my answer. Go and find it out yourself online. You're a grown man. You've got the internet.
I don't have time for that. I don't have time for that. You are the one. You are the one who said false
information. You can't even respond to your false information.
That is, that's all of them. They are Operation Dudula. They behave this way because they can't even support.
No, but hold on. You asked me a question. And I told you to find the answer.
It's fine, Azania. It's fine. I don't.
Why are you annoyed?
Let us go to the next one panel, please.
No. You're not going to do that. You asked me a question, and I'm telling you to find out the answer.
Azania, it's fine. It's fine. Let us go to the next panel, please. We don't want to argue, please. We don't want.
No, but I'm not arguing.
Let us avoid that.
Nobody's arguing with you.
Nothing. You know nothing. Thank you.
Let us relax. Nobody's fighting with you. You ask a question. Go find it out yourself. It's as simple as that. Why
I hate you? It's fine, Azania. Let us go. It's fine. I hate you.
Ish, guys, let's not go there. I've got a question for Undercover. Yeah, Undercover. My question to you is, how do you view the South African government's response to Operation Dudula? How do you view it? What do you make of their response to Operation Dudula, the government?
Okay, thank you so much for the question. So the government of South Africa, the response towards the Operation Dudula, according to me, too undercover. For me, it raised eyebrows the government of South Africa, which means they're involved. Some of the members, they're involved. In funding this Operation Dudula. Because why? Because see now what's going to be happening. The people, they're being turned away from the hospital, right? And what's happening now? The medication is being, being still, people, those people that work in the hospital, they're going to, people buying from them, stealing those medication and selling to those migrants. You understand it? And also, some of the migrants, they're going to start using the public, the private sector. You understand? Hospitals. So the whole thing here, because the government, if really they were not involved with this, Operation Dudula, they were supposed to act. You understand it? There's two things. Because Operation Dudula, what they're doing, what they're saying, it's okay. We acknowledge that if there's a problem of migrants undocumented in the country, the borders are open. But the way they, they behave towards these migrants, especially on turning away them from the hospital, it causing also a bigger challenge, not only to the country, but to the rest of the world, especially in terms of the disease. Those who people, they are infected, they are going back to the community. So my point, host, is, I believe as undercover, the government is involved with this Operation Dudula. And what they're doing, they want to create this, because obviously, maybe next year you're gonna start hearing, mark my words, hearing they said, oh, the HIV, rate, percentage is up. So we need, we need to intensify the testing. We need to buy, we need to buy, mobile clinics and whatever. Of which that's the ANC, that's the way they steal the money. You understand? Taxpayer out. So for them, that's why they can't do anything, because they are creating, in a way where they can loot them, the taxpayer out from the poor. So because obviously they come out, they say Operation Dudula, what they're doing, it's wrong, but they are not acting. So what?
Yeah.
My hand is up.
Okay. Okay, I'm checking. Okay, Babu Msoko, you want to respond to undercover, and Opiti, you want to respond to undercover. Both of you, is that correct?
Yes.
Yes, I want to respond to undercover.
Go on, Babu Msoko. I'm gonna come after you, my comrade.
Still undercover don't get our point as Dudula. We are not against immigrants here. We are dealing with our own problem, which we are facing in our public sector, of which our state funds, which we pay it with our hard-earning money, is being taken advantage of when undercover. That's what we are dealing about. So anything that affects us as citizens, we will take it heads on. So you may come with your narrative of funders and other things. We hear it by you that you are funded. We make contribution to Dudula. There are no funders there, but you can assist us also if you speak about funders and give us that evidence that this one and so is funding Dudula in this way. Then we'll appreciate it.
Okay, yeah, thank you.
I'm also going to respond to him.
Okay, let me correct you guys. Panel member, please listen for me very carefully when I'm submitting, because the way thing you are saying, you say totally things. I did not say Operation Dudula is fund. I was just asking Azania, guys, what's wrong with you? I don't know. I really don't know. I never even said this Dudula, the white they're funding. I just ask a question. You understand? To those people, they might think, you understand it. So I did not say that.
Okay, it's okay. You are fine. Having conspiracy theories is okay. We understand. Go ahead, Abit.
You know what? I just feel that Pakunzi, are you still here?
Oh yes, I'm still here. I'm just standing in for Miss Malone so that when she's settled in, she can take over. But I'm still here.
Okay,
I've got more questions for everyone.
Can you just quickly tell me what is the Nigerian spending on health per GDP? Sorry, I've had my chamomile, I can't speak. Per GDP, please.
What is Nigeria's health budget?
Yeah.
Is it the budget for?
I think it's
yes,
like
for health. Yeah. How much are they
it's
spending per GDP? Gangani Azania, let me hear from Upakuns.
okay.
I just want to test his integrity.
Okay, at the moment right now is 4.27%. Like right now it's 4.9 right now. That's been proposed for 2025. 4.9. Yeah, to health.
When was it proposed?
I can't.
So it's been
tell.
proposed, it hasn't been approved. So it's been
Not
proposed,
approved,
it
it's not
wasn't approved.
implemented.
What was it
You can
last year?
stick to 4.27. No, it was early.
What was it last year? What was it last year?
4.2%.
Okay, on education, how much is it?
Okay, I'm just putting that up quickly for you. Just putting that up for you quickly. Okay, on education, Jesus Christ, on education, we're looking at 0.35%
of
On
the
policy?
national budget.
Of the GDP.
Yeah, in the budget.
On policing?
And healthcare, Pakunzi, is it not 0.3 something percent for GDP for healthcare?
Check again, Pakunzi.
And then the 4% is national budget, not GDP.
Yeah, so right now on the proposed budget, this is for healthcare now. Just checking that quickly. Healthcare. So as the data that I have here for 2022 is 4.3%, and for what they're proposing is 4.27%. Yeah.
And then for policing?
Okay, let me check. Okay. Yeah, that's it. I'm trying to put that up quickly. For that is now 0.80%. Yeah.
And then for the defense?
Okay. Yeah, okay. Just check putting that up. Yeah, 2023 is 0.81%. And yeah, that's the latest that I have, 0.81%.
Wow, that's crazy.
And then South Africa is expected to pick up the tab. So basically Nigeria is spending less than 30% on its citizenry, if you were to consider that you guys don't have social security, isn't it, for citizens?
No, the social security is not there at the moment. So yeah, but it's just all talks. It's nothing concrete.
You have the highest number of people that live in poverty, but you have no social security for them, isn't it?
Yes. Yeah. That's it.
So
where
you
is
do
Miss
understand
Malone? She's gone. Oh, okay.
So you do understand that it is a bit it's not even a bit, it is disrespectful for Nigerians to demand healthcare in South Africa, whereas there is absolutely no provision for them by their own government.
I mean, for healthcare to be 4% of the national budget for a country of 300 million people, and South Africa budget's around 8% for what, 60? You are guys, Nigerians, please.
No, the Abuja Accord was signed in Abuja, whereby all African countries committed to spend 15% of their GDP towards healthcare. It was signed in Abuja, Nigeria, this Abuja Accord. And please, can you confirm when it was signed? Pakunzi, the Abuja Accord.
And Applety, isn't that what's the minimum according to who in terms